Leah, Teresa, thank you so much. That was wonderful. Thank you very much. And it feels to me that what you presented, your tool, is very much a great way of harnessing, I think, the emotion, the passion, experiences of patients to something that can have an impact. And in that way, it feels to me like you're closing the gap between patients on the one hand, and of course the professionals on the other. And I love the idea of actually getting researchers as well to reciprocate by also giving the stories, or almost getting them to perhaps step outside of their professional role a little bit. But I'm sure that will be a challenge. But I'm not going to go anymore because I've got some questions have come in. And I've got a question here from Claire. And it's your chance, Leah and Teresa, to help Claire with a proposal that she's writing at the moment. So I'm going to read this out. So Claire is writing a grant proposal to collect stories of people with sight loss to understand how eye care professionals do or don't consider their mental health and what they could do better. Now, Claire was going to interview them to hear their story, but perhaps she could use your tool instead. And would Claire be able to get the patients to do a module and create their own story?
Yes. And so like I'm a both and. So it would be, and I think Teresa, you can add to this, but I think one of the things that Teresa reflected on too is the reflective practice that writing itself has. So getting patients to write down their story in this sort of structured way may be able to give them insights in a different way that an interview may not. So I think it could be a great like two-pronged approach would be my thoughts. Teresa, do you have anything else to add?
No, I think you really covered it well there, Leah. It for a patient, even if you do an interview and you provide questions in advance, it would be helpful to do the storytelling module just because it helps us to reflect and to get the salient points out where you may not get that if you just did the interview and were asking them questions. You may get part of it, but you may get a better result if they went through the storytelling first.
Fantastic. Thank you. Oh, well, I hope that was very useful to the person that answered the question, to Claire. So, Claire, there's your answer. Um, some more questions have come in. And this question is from Rachel, and it's really about how much this transfers to other cultures. And Rachel's question is, how do you think storytelling can be used in countries where patient-centered care is not the norm? And would you make changes to these modules and about how the stories are prepared if used in that case?
Teresa, want me to go?
Yeah, sure. You go first.
So I think the important piece here, wherever you have patients share their story, whether or not patient or family centered care is the practice, is the setting of the context, creating a safe space for the story to be shared. So again, with the in-person module, although it can be done, it's so you have to give it time. You have to allow the patient story to be shared. And then the important piece, I believe, is then the exchange, the interaction. So I actually think that this might be a really nice way to start showcasing in other places where patient and family centered care isn't the model, the impact of hearing patient stories. Right. So it's leveraging the cross cultural understanding and impact and experience and history with storytelling to help healthcare providers and researchers hear and understand the patient experience in a different way that they're maybe not used to.
I would agree, Leah. I think storytelling has been around since the beginning of time, and using this tool for patients to be able to better express themselves, I think could lead to patients becoming more involved or having um, people communicate better, whether it be in research or in any setting.
Brilliant. Thank you, Teresa. Thank you, Leah. And Rachel, I hope that was helpful. Please let us know in the chat function. I've got a question here now from Kimberly. And Kimberly asks, how did you find your Indigenous advisors? Because Kimberly has worked with Indigenous advisors before, but she's found it quite challenging at times because the main barriers have been busy schedules and getting so many requests, of course, something we all experience, I think, from other organizations. So how did you find your Indigenous advisors?
Yeah, it's a good question. And so initially, the patient partners involved in CanSolve were actually recruited by their healthcare professionals because there was a relationship of trust that was already built there. So I think an ask from a stranger falls a bit more flat than a request from someone who's already a known and where there's trust built. So I think that's really important, particularly when working with our Indigenous partners. Um, and once you have sort of a connection with the community, if there's anybody that you're working with that has been connected to the Indigenous community in your area, it's slow and it's about building trust first. And so asking what that would look like with your Indigenous partners, how can we build trust? This is what we want to do. Like, please, like guide us in how we make that connection. And I would say allow them to sort of guide the process. If that's helpful.
Leah, I think you make a really good point because it's, you said during the presentation, asking people how they want to be involved. And if you share that goal with your communities and then ask them how they want to help reach that goal, I think as a patient partner, that's very important. And it allows people to get involved where they can help.
Fantastic, thank you. And I've got a question from Sonia, which I think is in the same ballpark, very much as Claire's, the first question. And Sonia's project is on carers of children affected by asthma and allergies, and creating their digital stories of what it's like for them and how their conditions affected their daily lives. So would, again, your tool, could that be used with that group of people?
Yeah, I think we started with the model of moments of care. Like you can look at that and maybe just ask a different question, more related to research. And I think the real bottom line is it's the self-reflection process. So we've created tools and roadmaps for writing and thinking, again, moving away from the chronology of the illness experience. And so it really can, I think, be adapted to, whatever it is that you're wanting your folks to reflect on.
Fantastic, thank you. And as chair, I'm going to ask one last question, Leah and Teresa, and it's something you did touch on, Leah, and it was about impact. And as you know, and I'm sure it's the same in Canada as in the UK, everybody at the moment is crazy for impact. You have to demonstrate what it is that you do and achieve. And you did touch on it briefly about impact, but what would you say to perhaps to, and I'm assuming this would be more likely the healthcare professionals would say, oh, but how can you demonstrate that this has a positive impact? Where's your evidence? What would your response be to that?
Yeah, one is we need to decolonize ourselves a little bit and impact, right? We need to move away from a sole emphasis on quantitative data. This is a qualitative experience. And so we need to be able to value the testimonials of the people in the audience that, like we shared earlier, who have said that this has impacted them. So it's the ever ongoing debate about what evidence do we put our weight in. I think we can get really creative, and I think you have to define it as impact. But it's starting to think outside the box in where we place value, right? And that's hard because our research funders want the quantitative stuff, but if we just all as a group say, we ain't going to give it to you, we're going to give you this stuff, and this is where we're putting all value, maybe there can be an uprising, who knows.